So thank you to everyone here, Pamela, Glenn, Bernice, Stephen. These are just really exceptional people, and I'm so pleased to be included in the Scientific Advisory Council of Bring Change to Mind. As I said today in our council meeting, I've been a huge fan of Bring Change to Mind for many, many years, and so it's really great to be joining this esteemed group. I'm here to, I have like just a few minutes to cover BIPOC youth, and that's a tall order, but I have just a few kind of facts to share, but I wanted to start off and let you know that in the middle of, so my work, I'm a psychiatrist and I work at UC Davis, and I have a number of responsibilities there. I take care of young people that have just been diagnosed with psychotic illnesses. But in addition to that work, I also spend a fair amount of time doing administrative work, working with young medical students. UC Davis is known for having one of the most diverse medical schools in the country, and so we admit more people of color, more people from disadvantaged backgrounds than probably any other medical school in the country that's not a historically black college and university. And with that, it's wonderful, but with that, I think, comes the challenges of the stigma and the discrimination that people of color and minoritized communities face. And so while we were in our Scientific Advisory Council meeting just today, I got an email from one of my talented medical students of color. And she said, "Hi, Dr. Shim, I'm just wanting to speak with you because I've been struggling with anxiety and depression, and I think I need to start some medication, but I'm afraid. So let's talk about it." And I so appreciate that she could reach out to me, and we are going to talk about it. But I was struck by the idea that stigma for a medical student who's going to be a physician is still very powerful and very strong, and still is kind of at the centerpiece of this problem that we're trying to face. So with that, I want to kind of just share with you a little bit of information about the role and the challenges of trying to address and eliminate stigma in BIPOC youth. So John A. Powell and Stephen Menendian, they both define othering as a set of dynamics, processes, and structures that engender marginality and persistent inequity across any of the full range of human differences based on group inequities. And so this includes, but is not limited to, religion, sex, race, ethnicity, class, disability, sexual orientation, and skin tone. And so if we're thinking about what othering means, we could think of it as kind of an us versus them mentality. And we can also think about it as negating another person's humanity. And so when we other people, we see them as less worthy of dignity and respect. And so throughout history, we have othered people of color, and particularly youth of color, in various settings. So we can look at the education system, the child welfare system, and the juvenile justice system. And so for a couple of examples, a little bit of data, Black boys make up about 18% of male preschool enrollment, but about 41% of male preschool suspensions. And Black girls make up about 19% of female preschool enrollment, but account for 53% of female suspensions. And Latinx youth are about 28% more likely to be incarcerated than white youth. And Indigenous children have the highest rates of child victimization in the United States. So last year, there was a morbidity and mortality weekly report. This is a report that comes out by the Centers for Disease Control and Prevention, the CDC. And they found that children and adolescents that live in poverty and are from minoritized backgrounds fare much worse than their peers in access to mental health care, in identifiable risk factors, and in the prevalence of certain mental health conditions. So a couple of key findings from that CDC report include the impact of adverse childhood experiences and social determinants of health. So things like housing instability, food insecurity, poverty, community violence, and discrimination. So these experiences can have a cumulative effect on stress response in young people. So young people can actually be protected from these harmful effects by positive parent-child relationships, having quality educational experiences, and living in safe neighborhoods. Also from the CDC report, we have some data that shows that suicide rates are the highest among Indigenous people compared to all other racial groups, among Indigenous young people in particular. And we have to view that data through the lens of historical trauma, and specifically thinking about the idea about how Indigenous children were forcibly removed from their families and placed into Indian boarding schools and non-tribal foster care. And so that historical trauma led to intergenerational effects that are showing up in the ways that we see Indigenous youth with suicidal thoughts. But I will say that the news is not all bleak. We are beginning to understand that cultural practices and traditions have protected Black and Indigenous children from the effects of toxic stress. And so when youth experience positive self-image, when they have caregivers that emphasize belonging and inclusion, the harmful effects of stigma and trauma are greatly reduced. So often the practice of radical belonging and self-acceptance is originating from youth of color. And so we as adults have the opportunity to learn from these experts with lived experience on how to be a more inclusive society. So I'm gonna wrap it up, but in the spirit of focusing on belonging and trying to bring belonging into this conversation about youth of color, I want to just leave you with the words of our National Youth Poet Laureate, Amanda Gorman. And she said, and we all know, she's a sociologist? Oh, wow. We know her amazing poem, and in that poem she said, "We will not be turned around or interrupted by intimidation, because we know our inaction and inertia will be the inheritance of the next generation. Our blunders become their burdens. But one thing is certain, if we merge mercy with might and might with right, then love becomes our legacy and change our children's birthright." Thank you.